with the medical community, there is still more work to do to convince people to take a COVID-19 vaccine.
A recent survey of nurses in the state says just more than half say they will get it, with the rest unwilling or just unsure. Our Capitol reporter Michael Hyland live in Raleigh for us. And Michael, state health officials say the number of people willing to get vaccinated has got to go up.
Yeah, hospital workers here at Duke Raleigh got a chance to get the Pfizer vaccine today. But this new polls show there is some hesitancy, even among healthcare workers, with some wanting to know more about it before they commit to getting it. Thousands of doses of Pfizer's COVID-19 vaccine arrived Thursday at hospitals across the state. They quickly went into the arms of healthcare workers on the front lines of the COVID-19 pandemic, including at Duke. Dr. Dennis Taylor, head of the state's Nurses Association, says his turn is coming this week.
I think nurses have a responsibility to be the ones to show and set the example that it is a safe vaccine.
He found some nurses need more convincing. After a national survey found only a third of nurses said they definitely get a vaccine, he wanted to know how North Carolina nurses feel. About 56% say they're willing to get vaccinated, 26% are unsure, and 16% say no. Taylor says there are a variety of reasons some nurses are holding off or are unwilling.
The biggest ones have been misinformation, disinformation, not being able to trust the information that's being published.
Some want to see what happens with other people first.
And a lot of our members, too, in terms of their hesitancy, has been, well, I'm just going to wait and see what the side effects of it are and things like that.
Governor Roy Cooper says the state is trying to boost confidence in the vaccines. They've prioritized healthcare workers initially because of the risks they face, but also hoping they'll be able to tell people about their experiences.
I believe that we can turn around a lot of the misinformation and the misunderstanding and get enough people vaccinated.
Coming up at 6, you're going to hear from an ER doctor here at Duke Raleigh who just got the first dose of the vaccine today. And you're going to hear why our major hospital systems in the area are not requiring employees to get the vaccine. Live in Raleigh, Michael Hyland, CBS 17 News.